but I know that we at Mount Pacific are really enjoying them, and I hope that they are worthwhile to you all. So today I'm going to talk a little bit about the National Healthcare Safety Network, or NHSN, updates. There has actually been new information that's come out since we put these slides together, so I'll cover those too. And then my colleague Jesse is going to discuss routine COVID staff testing in long-term care facilities. So next slide. So please, as always, if you have burning questions or things you want us to cover, add those into the chat, and we will keep track of those as we're planning out the rest of the year. And we're going to be keeping this meeting on every Wednesday, we believe, at least through the end of the year, as long as we're still adding value and have interesting things we can talk about. Next slide. All right, so for the recent NHSN reporting updates, go ahead, next slide, Mary. My colleague, Tom Vincent, put this together. I am kind of trying to recover from a cold here, so my brain's not functioning the best. If you have questions that I can't answer, we will for sure get those answered and back out to you. These updates were from February of 2022. And I'll go through those and then I'll let you know what just came out, I think today, maybe yesterday. So in February, they CDC included vendors as other contract personnel in their language. They also elaborated on medical contraindication after one dose and removed question 4, which was eligible for additional or a booster dose. Next slide. So for vendors previously, one of the FAQs for NHSN was instructing users not to include vendors as healthcare personnel, but apparently after receiving feedback, they've updated their guidance to include them under other contract personnel if they're coming regularly into the facility. And I imagine that's the catch, regardless of their clinical responsibility or patient contact. The guidance, I think this is a presentation slide set that we've got linked down below that illuminates that a little bit more. They're asking you to follow that guidance moving forward. And I probably shouldn't say this out loud. Revise data reported for prior weeks if possible. I kind of snorted when I saw that, but they say it, so I'm gonna say it. I know how I would feel if I saw that. Next slide. So in that February 2022 release, the question on the individuals who are eligible for an additional dose or booster, which is in question 4, is no longer included. And the reasons for that was they were trying to simplify reporting, which is nice. And it was unnecessary at this point since now almost everyone's eligible. Next slide. So in the event level vaccination forms, they offer a third option for entering your cumulative weekly data. They can also be used to track your individual resident and healthcare personnel vaccination information. Next slide, please. So you've got to be a SAMS level 3 user to access them. You're in the long-term care facility component. You go to your COVID-19 tab and then select the event level COVID-19 vaccination form for healthcare worker, or event level COVID-19 vaccination form for residents. They're 2 separate ones. Next slide. The advantage to using these forms is that it'll simplify your summary data reporting. It allows you to document your information at your person level, whether it's your healthcare workers or your residents. The application will automatically calculate and display your totals. You don't need to manually calculate and enter totals in the summary forms. You just simply update your person level data and use the summary to review the totals and submit your weekly data. And it'll capture changes in vaccination status over time, and it allows you to record your religious exemptions. And again, we've got it all linked there where they go into greater detail on what those changes entail. Next slide. So here coming in, I think this is all the updates that just came out. I'm comparing to what we just received today on my screen. So updates coming in May. They're going to revise some of these cumulative summary forms. The COVID vaccination data will no longer be reported by manufacturer for questions on your primary and additional booster doses. They're removing the questions on vaccine supply, and I believe they're also removing the PPE question. I need to verify that, but I think I saw or heard that somewhere. The completing your monthly reporting plans for your COVID vaccination modules are not going to be required anymore. And they're ensuring that the data reported is consistent with the definitions outlined in their surveillance protocol. And then they're sending that data to CMS just to fulfill that quality reporting requirement. And I just want to make sure they're next slide. Maybe we cover this on the next slide. Okay, so the NHSN newsletter that came out, I believe it was today, also says they're adding, maybe we mentioned this, a cumulative number of individuals who are up to date with your COVID-19 vaccination rate. And as Jesse's put there in the chat, there are a couple of updated trainings on the May updates. They haven't said when they're going to have those completed, but their trainings are at the end of the month. There's, I think I'm just seeing one on May 25th at 2 p.m. Eastern time. I believe that we have sent out that information already today, but Jesse has again linked it there in the chat. And then here are some quick, easy links to get to some of the NHSN COVID module updated information and FAQs. Any questions on that? I'm going to look through the chat here and see if there's anything. Well, all right. Phew. Hopefully they continue to attempt to simplify that for everyone, because I know how time intensive that is when you really need to be working with your caregivers and your residents. So fingers are crossed. So next up, we'll have Jesse review staff testing, routine staff testing. Thanks.
Thank you, Dana. So I thought I would just kind of do a little micro learning session today, kind of review and go over some reminders in regards to routine COVID-19 staff testing. Go ahead, next slide, please. So most of us should probably be familiar with this testing summary by now. And really, you know, our county transmission rates have gone up and down. And what I wanted to focus on today is really, as we look at routine testing, maybe for those staff members that have exemptions, and that might be part of our mitigation plan, is providing that more frequent testing for those staff. So go ahead and go next slide, please. But before I touch upon routine testing, I thought it would be important just to make a statement on symptomatic COVID-19 testing and just visit it a little bit and the differences between symptomatic COVID-19 testing and some reminders. So when we're looking at symptomatic testing, we want to make sure that you know, we're performing that testing in the appropriate location, avoiding those centrally general public type areas, not lobbies. And really a reminder on symptomatic testing too, as we look at this, not only having that designated area, but ensuring that your staff are understanding of your current policies. So if they're feeling symptomatic, do you guys have a process where they call ahead and maybe you meet them outside and you do testing prior to the entry? So reminding folks to make sure that their staff members are fully aware of what that testing picture looks like if they're symptomatic versus routine. Next slide, please. So routine COVID testing, again, some reminders as we look at setting a testing station and considering where you're going to choose your testing location. You want to make sure that you're choosing a well-ventilated area. A low traffic area. Again, we really want to avoid those general public areas, avoiding the lounge or the public entrance area. You want to designate clean and dirty areas and have a testing policy in place as well as a disinfection process. And this designation in clean and dirty area, I just want to take a moment and kind of highlight that a little bit. This is an area of concern when we go in and we've been reviewing infection control surveys and things that have come up as kind of a common place of fault that we want to be careful. So when you set up those clean and dirty areas for your testing supplies, is there a division between those areas? Is there signage? One thing that has been coming up is when you're waiting for your test, are you putting that use test next to the clean test on the same table? So we want to make sure that we're cognitive of designating those areas and a separation between the two. Next slide, please. So we look at during the test and in setup, we want to make sure that there's no clutter, food, drinks present in the testing area. This may come into play if you're using maybe an office for your testing, and you may have other things on the desk in that office area, or maybe you have an office mate. You want to make sure that, again, there's no food or drinks present. Signage is present when you're testing. You want to make sure you use testing supplies and waste directly in the trash or per your policy for disposal of those items. Use good hand hygiene practices. And this has actually come up in a citation that I've seen a little bit here recently. Make sure you're changing gloves between handling the specimens to prevent cross-contamination. So here's a good question that came up from a facility. If my employees are testing them, doing the swabs themselves for routine testing, and they're handing me the swab to put in the tube and to send off, do I still need to change my gloves? The answer is yes. Even though you are not conducting the test yourself, you're still touching that specimen and there is still an opportunity for cross-contamination. So ensuring that you're changing gloves between handling specimens is absolutely important. So, again, these are kind of some little items that you can cross-check and audit maybe as you look at your routine COVID-19 testing. Next slide, please. So after the test, we want to make sure that we're properly discarding of those materials, and we're disinfecting all testing surfaces after completion of testing. I couldn't think of anything worse than sharing my office as a testing site, but my partner that's performing the testing is not cleaning routinely. So this is a good time to review how are you cleaning and disinfecting after completing testing. So again, those surface areas. And reminding ourselves that we want to make sure that we're following those core principles of infection prevention. And these items that I'm going over, a lot of these are, they're straight from a checklist. So these would be great points to audit. Next slide, please. So what to avoid? High traffic areas, again, poorly ventilated spaces, lack of disinfection. So I've also seen some citations where they have the routine testing stations set up, but there is no disinfectant anywhere in the area. So we want to make sure that you have the proper disinfectant there. Movement from dirty to clean areas. Again, how are those areas separated and is there clear signage? Food and drink in testing areas, definitely want to avoid that. Mishandling waste. Make sure you review your internal policies for proper disposal of those items and manufacturer recommendations. Not social distancing. Definitely, we want to make sure that we're cognitive of this. And cluttered testing services. This is one that's also come up in some citations and discussion. Again, perfect example, as I shared earlier, you have those that have taken their test, they've placed perhaps those rapids on the table in front of them, but right next to where they just placed the one that's used is the new ones or the clean ones or the unused ones. So you have a great risk of cross-contamination. So I want to make sure you're allowing yourself space. Next slide, please. Well, with that, again, that was a micro learning, just some reminders as we look at our routine testing stations. And I know that, you know, there's quite a few of us that have a handful of exemptions, and we've been using that increased testing frequency as part of our mitigation strategy. So no better timing than now to maybe do a little self-assessment or audit of how you're setting up your routine testing station, and make sure that we're being safe and reducing our risk for cross-contamination. With that, I don't think I see anything in chat, but does anyone have any questions? Oh, good question. How far apart between clean and dirty areas? So this came up in a Department of Health call that I participated in a couple weeks ago. And they said as long as there was a clear separation, signage, maybe tape, they said that that would be appropriate, that you're designating it, but they did not specify actual measurements. I'll look and see if, I'll reach back out to those guys and see if there is a parameter though. Good question. And then the other question, do we place the used tests in biohazard or regular waste? Okay, so same Department of Health call, this came up as well. And depending upon the test type that you're using, it actually says that it's technically only biohazard a matter of minutes. And after that period, it can actually go into regular waste. So pretty interesting dialogue around the difference between biohazard and regular waste disposal. But you think about it, those rapid tests, they're selling those over the counter now, and they're going into regular waste. I will also see if I can find a source and we can share forward with you guys to speak to that too. Curious, how we're most disposing of those tests. Are you just going in the regular waste? Yeah, and that's appropriate from the calls I've been participating in. Yeah. Is anyone disposing in biohazard? Oh, okay. Yeah. Yeah, and the conversation that I caught was the package insert for one of those rapids that's been distributed. It says okay to put into to regular waste. The only caveat is that your the manner in which you are disposing of it and the receptacle that you're putting it in, it needs to be labeled as such. So I will add that. That was the other comment on that call. Good question. Signage for clean and dirty, what would that look like? Simple, easy. You could do designated clean space, designated dirty space. Yeah, nothing specific there. And I'd be more than happy to look and see if there is some graphics online that you can print or some signage. Yeah, if I find it, I'll send it to you guys. Good questions. Good questions. How many folks are performing routine testing because of their handful of exemptions? Oh, and Cindy says, we're using the Abbott Binax Now tests, and because they label patient information on those tests, they're putting it in biohazard. And it looks like a mixed bag too. Some folks are still testing based on community rates, and some they've transitioned to routine weekly testing for those unvaccinated employees. Yeah. Oh, and good point. Recommendation to cover the surface when testing. Very good recommendation. And then you could wrap that up and dispose of everything and then wipe the surface. Good idea. Yes. Yeah. Vanessa, I have a feeling, Vanessa says we're testing per community rate, and now the up to date has increased our numbers to test. Yeah. Yeah, some folks have moved back to twice a week in their area again. Yeah, good dialogue, you guys. I think the take-home message really, when we look at our routine testing station, is be cognitive of where you're testing, how you're cleaning, good infection, core infection prevention, processes. Make sure you're following those, and then make sure too you have some reminders of for staff for that symptomatic testing, that hey, if you're experiencing any symptoms, do they understand to call ahead? Do they understand the process for your facility? Cynthia, yeah, preparing for twice weekly, we'll add signage for clean and dirty. Yeah, and like I mentioned, it came up in a couple phone calls where Department of Health and some survey folks were present in surrounding regions. And they said that's one area of concern that they're seeing is really there's kind of a clutter in mixture of that surface area with our use tests and clean tests. So definitely sharing that forward for you guys to be mindful of and how you're setting that up. All right. Well, next slide, please. I just put some resources on here. As usual, we will have this slide deck sent out after our presentation, and it'll also be uploaded to our website. So if you have any questions, again, feel free to reach out to us. And then there's a self-assessment checklist in here too for infection control kind of reminders, and guidance for setting up your rapid testing. There's a link. So just, again, resources, knowledge sharing. So those will be shared forward after our presentation. As always, we thank everyone for attending, and we look forward to next week's Worth a Shot presentation. And if you have a moment, we do have a link in the chat box, an evaluation link. If you wouldn't mind taking a moment and filling that out and providing any suggestions on future presentations, we would greatly appreciate it. Oh, and I see Cindy too. She references the VA policy for testing frequency. Yeah. Great dialogue today, you guys. I really appreciate the participation. Thank you, everyone. This concludes this week's Worth a Shot series. Please join us next week on Wednesday, May 18th, 2022. Thank you.